Governor Raimondo says field hospitals in Rhode Island are ready for a potential surge in cases of COVID-19, but she hopes the state never has to use them.
And in New York, they weren't as lucky. As hospitalization and death rates rose, so did the need for more hospital capacity. That's when the Javits Center was put to use.
And now we're learning one of the people leading the charge at that center is a native Rhode Islander. Eyewitness News reporter Caroline Goggin shares her story.
New York City quickly became the epicenter of the coronavirus outbreak here in the U.S. As the virus was at its worst there, a native Rhode Islander had to be at her best as she helped to lead the charge at one of the nation's largest field hospitals.
New York City's Javits Center is now one of the largest hospitals in the United States.
In a matter of days, the massive Javits Convention Center in Manhattan was quickly turned into the Javits New York Medical Station, a 2,500-bed facility for COVID-19 patients.
We're busy, however, just really proud to serve our country.
Colonel Kimberly Aiello is the commander of the 44th Medical Brigade, one of the largest in the country, based in Fort Bragg, North Carolina. She also happens to be a Rhode Island native who was called upon in March to assist in the operations at Javits. For the past 6 weeks, she has worked hand in hand with FEMA, the Department of Health and Human Services, and the state of New York.
Someone comes into the emergency room. 1 of 4 of them are going to end up to be a vented patient. Those are the kind of patients we need and want to stay in our city hospitals. However, as they start coming across and go through the virus at about 14, 17 days, especially if it had been a ventilated patient, as they come off a ventilator, those are the patients that we want to see in our facility.
Colonel Aiello grew up in Cranston, went to Cranston East, and still has family living in Rhode Island. She joined the Army in 1992, has been deployed to the Middle East, and now she's found herself on the front lines of a much different battle with a silent enemy.
And to just see that death across the city hospitals is absolutely unimaginable. You can't capture that on a phone call, and I can't capture that in a video.
Aiello says the operation at the Javits Center has freed up space in New York City hospitals for patients who are critically ill. She says at this field hospital, they've seen about 1,100 non-urgent patients. Right now, they're serving less than 150.
That's good news, because it really goes to show that although still a serious situation here in New York City with the virus, you're starting to see all hospitals across New York City and across New York State are decreasing.
Despite the improvement, Aiello says it is imperative people continue to stay home, something she hopes her fellow Rhode Islanders adhere to.
It's a disease you can't see, so it's hard to fight. So I just really recommend any guidelines that's placed by the state, by the governor or the mayor, that we definitely adhere to.
Colonel Aiello tells me more than 2,700 military medical personnel are currently in the Northeast to assist communities impacted by COVID-19. I'm Caroline Goggin, Eyewitness News.